Hello, I'm Dr. Michael Fossel. The most important advances that have ever occurred in medical science have not occurred because of incremental technical advances like monoclonal antibodies or CRISPR. They have occurred because we've understood the disease, and those have offered us larger rewards, both clinically and financially, than any other approach. What we're offering is exactly the same thing. We're offering an approach that can cure and prevent age-related diseases that have until now proven intractable. And as a result, the market, the opportunity, and the ROI are all without precedent. We're not dealing with rabbits, to quote Lee Bai here. What we're dealing with is what in biotech would be called unicorns. Maybe a unicorn's unicorn. What we're suggesting we can do is reset cellular aging at the basic fundamental genetic and cellular levels. We are a preclinical stage company. We're dealing with fundamental mechanisms that are disease modifying. What we'll be doing is using telomerase gene therapy to re-lengthen telomeres, reset the pattern of gene expression, and restore normal cell function. This is a platform approach. It is not limited to the central nervous system neurodegenerative diseases like Alzheimer's, although that's our first strategic target. We're also going after then cardiovascular disease and a panoply of other age-related diseases. When we're looking at Alzheimer's, we target all the known biomarkers because we're dealing with fundamental mechanisms. So it's not just a matter of beta amyloid, tau tangles, mitochondrial dysfunction, inflammatory changes, neurogenesis, but all of them together. In short, all of our competitors are targeting specific biomarkers like beta amyloid. So they're looking at downstream targets rather than fundamental upstream causes of age-related diseases. Here's an example. Eli Lilly's solanezumab compared to placebo shows the same downhill course and fatal outcome with an offset of about 8 weeks. The same is true when we look at Biogen's anakinumab study. When you're looking at different doses, no matter what dose you look at, you're still looking at parallel vectors and the same fatal outcome. What we'd like to do is use a disease-modifying therapy to actually improve the cognitive status of patients and give them an improved outcome. The data supports this, the literature supports this, particularly my article there in the upper left, which generated more than 600 global reprint requests in the first 2 months of publication. But the entire literature is also supportive when we're looking at Alzheimer's process, whether we're looking at an effective intervention, whether we're looking at neuronal improvement, mitochondrial improvement, or inflammatory changes. And all of these studies are available on our corporate deck, which is available to you at any time. The same is true when we look at what happens when we try this. It is feasible and effective. It's been used in mice with good effect, and you see an improvement not only in overall lifespan and physiology, but specifically in behavioral improvement. It's also safe and beneficial. There are a number of studies that have looked at the kind of things we'll be doing, and the risk-benefit ratio to patients is enormously in favor of the patient. So probably the best model for us to move forward is a dog model. We'll be doing a dog study later this year, in which we'll be looking at proof of concept, intellectual property, dosing, route, safety, toxicity, histology, before we take it to human trials and approach the FDA. We're looking at patients with moderate Alzheimer's. We're looking at a 6-month trial, a single intervention, and we'll be doing the first trial in the United States and then moving phase 2 trials out globally. Program budget for 4 years, about $17 million to take us through phase 1. We have a team that is very experienced. I gave the first talk on this at NIH 25 years ago. We have people who've been involved in this globally for a long time. The same is true of our scientific advisory board. These are people who actually run corporations or run institutes globally. They have experience and they're behind us in all regards. Equally true with regard to our clinical board. These are neurologists with global reputations at Harvard, USC, KUMC, Sunnybrook in Canada. These are people who are behind us and would like to see us do this. So I urge you to get in touch if you're interested, because we're dealing with a future far beyond just Alzheimer's. Thank you.